Welcome to Spank University, your favorite educational resource for all things sexy. Here at Spank University, we help keep you safe and informed about all things related to sex work, sex positivity, sex activism, and how to practice safe sex. Everyone loves to have fun, and in the heat of the moment, we don't always make the best decisions. That's why planning for safety before things heat up is so important. All social activities come with risk of exposure to communicable diseases, some of which are unique to sexual activity. Sexually transmitted infections, or STIs, are infectious diseases that are primarily transmitted through sexual contact. The industry uses a system operated by a nonprofit organization, PASS, which has its own proprietary testing databases to collect information from performers. PASS also sets standards for STI testing guidelines for work clearance and provides a number of other health and safety tools and resources for adult industry content creators. Having a central testing database is important for a number of reasons. It prevents fraudulent testing, it helps performers easily and discreetly share testing information with one another, and it provides the visibility needed to prevent an outbreak. Porn performers get tested every 14 days for a variety of STIs, including In March 2022, we sponsored the first ever screening pilot for Mycoplasma genitalium, commonly known as MGen, in the American adult industry in partnership with PASS. MGen is an STI that was first identified in 1980. The lack of awareness regarding this little-known bacterium may be accounted for by the fact that it only affects 1 to 3% of the population and that some infections are asymptomatic. However, MGen can have notable consequences, including urethritis in men and cervicitis in women. And if you think that one-fingered glove makes you invincible, think again. While an effective tool, condoms can and do fail. Additionally, a number of STIs can sneak their way from skin to skin in the areas the condom does not cover, and condoms can also slip or break. Depending on the person, some STIs don't even show symptoms. This means an infected person can spread the disease to others without ever even knowing it. STIs can be passed back and forth between partners if both parties are not getting tested and treated. This is why testing early and frequently is your first, last, and sometimes only line of defense. Over half of Americans will get an STI in their lifetime. There is still a lot of stigma surrounding STIs, which makes getting one really scary. But getting an STI does not make someone dirty. Anyone who is having sex is at risk for an STI. Because of the stigma, many people refuse to get tested, and some are simply afraid to discover they have something. Here at Spank University, we promote a culture of open communication by destigmatizing testing and treatment and offering community support. Because few people talk about it openly, it's easy for people to think that they are the only ones with an STI. But according to the Kaiser Foundation, there are 20 million new cases each year, and over half of Americans will get an STI in their lifetime. If you do happen to get an STI, early detection and treatment are crucial for preventing long-term health complications. Knowing your STI status is one of the best ways to protect yourself and your community. It enables you to make informed decisions about safer sex practices and can empower you to prevent spreading your STI to your partners. The good news is that all STIs are treatable and most are curable. Every diagnosis is a public health success that helps protect our community. Our goal is to raise awareness and encourage performers to protect each other by protecting themselves. For more information on how you can get tested, go here. There are many different testing methods, such as clinic visits, home testing kits, and online services. Many local health clinics, healthcare providers, and other organizations offer confidential and affordable testing. Remember that even if you test negative, you still need to be careful and mindful of your partner's practices. Some tests only work if someone has an active infection, and some tests require multiple rounds, where it's best to test right away and 3 months after. It's important that we all prioritize our sexual health by getting tested regularly. Please visit your local clinic or seek out online testing services for more information. For more information about PASS, visit their website at passcertified.org. Learning someone has had an STI means they took action to protect themselves and the people they had sex with. Making STI testing and reporting shameful reduces people's willingness to do it and makes us all less safe. The best thing you can do is to thank them for sharing their status and empathize with what they're going through. If you are or have been sexually active with them, be sure to test yourself right away. And remember, the STIs can happen even with the most diligent of protection.
You wanted to say MGen, it's fine.
Oh, I'm gonna say it. say the whole thing. We're getting technical, we're getting medical.
Listen, I love it.
I'm gonna say both.